Hi, and welcome back to Unmasking the Trans Movement with John Euler. I'm your host, Brad Wilder. Last time on the show, Robin Atkins stopped in. We had a great chat with her. She's a mental health counselor of 19 years, and this comes with a variety of settings. So not only with clinical settings in terms of hospital-type environments, but also clinical in the sense of, the office space, and then working not only with adults, males, females, but also some children along the way too. She's chair of the subsection of the American Association as well of pro-life OBGYNs. She's also a molestation and rape survivor and a post-aborted woman. She specializes in mental health, obviously, for the last 7 years working with rape survivors and rape trauma victims, pregnancy trauma. She's really a sexual help survivor, getting people past all the trauma that comes with such an event as this. We're talking about the trans movement. We've been doing that forever. We're going to continue to do that forever. You're not going to stop us. We are not against LGBTQ or trans rights or any of that. What we are about is you forcing it down our kids. And that exposing not only our kids, but women and children and protecting the most vulnerable is foremost on both my mind and obviously John Euler.
Brad, thank you. We are in the midst of a series, as it were, now with Robin Atkins that's beginning here. It will extend in future broadcasts or episodes. Robin is such a wealth of information, and she has covered so many topics that are pertinent to the trans movement as far as its deception and what it is doing to kids. It's setting them up for being manipulated and easily targeted by those that would set them up for financial and sexual predation. Part one, if you have not seen that, I recommend you go back and start with part one because we covered in depth issues of mandated reporting, issues of informed consent, and how those that are pushing this do not allow for and do not give kids, and including parents, do not give them those as far as mandatory reporting and informed consent. Robin, I would like for you to, as we discussed between the break, the role of Planned Parenthood, I'd love for you now to discuss that, as well as you as a mother, not just as a therapist, but as a mother, you experienced finding your own child on the receiving end of a therapist that became an activist. So I want to make sure you're able to cover those. Those are so pertinent because parents right now are living through that. And so if you would like to, why don't we actually start with Planned Parenthood, and where would you like to start? Because they have a lot of history behind them. Has been working with young people who have experienced rape, who have experienced molestation, who have experienced the effects of confusion, especially gender dysphoria. So it's a privilege to have her back. We covered issues of mandatory reporting. We covered issues of informed consent. That is our concern, that if you're going to push medical procedures upon a kid, you better be able to, as a mandated reporter, you better be able to discern, are you dealing with a confused kid, or are you dealing with a child that's been molested or is currently being molested? Because they will not come out and tell you that. So as a mandated reporter, you best not reframe the signs or symptoms or red flags of abuse in terms of gender, because then you will be harming a kid. You'll consign them to silence. They need a place to talk, and no child, rare is the time a child's going to come out and saying, I'm being perped on. They're going to give you hints such as, I don't want to be a girl, I wish I was a boy. That's why a mandated reporter needs to act with discernment and not, quote unquote, just affirm and move them along to medical procedures. The other is, you'd better be able to discern the red flags of potential predators. And those predators come in different shapes and sizes, the sexual, but also those that are going to view kids as a means to an end, a financial windfall. Robin, you are very familiar with Planned Parenthood.
Hmm.
Talk to us about Planned Parenthood's role in all of this, their stake in this, their interest, and even their origins. People may not know because they have marketed themselves as pro everything and all things good, clean, virtuous, and noble.
Hmm. Well, I actually would like to start with the origins and work our way forward. So, Planned Parenthood was started by a woman named Margaret Sanger, who promoted the idea that she was giving women freedom by offering them contraceptives. And the whole concept around that was the woman's biology is the problem. Women need to halt their own biology rather than society accept the healthy biology of women and society make room for pregnancy and birth and postpartum. So from 1920s, we see women's biology being pinned as the issue and women needing to halt healthy biology. So there's
She
the
was, as a
beginning.
matter of fact, Robin, Margaret Sanger was a eugenicist.
Correct. Yes. So aside from pinpointing women's biology as the issue and us needing to halt healthy biology, which is the trans movement, halt healthy biology. We see it starting in 1920 with that, with women specifically. She also wanted to limit the number of people that were reproducing or having children that were either had been accused or commit accused or um, found guilty of a crime or of any mental health issue or any physical disability. She wanted to limit reproduction. So eugenics came into the picture at that point. And
She was also a racist.
yeah, there is some, I guess, worthy conversation to be had around was that her legitimate intention or um, was she misquoted and taken out of context there? I don't know that she was a racist as much as she hated those in poverty. She was elitist. And because the majority of poverty was African Americans in that time, that they were brought into that, as opposed to her hating skin color per se. So I'm not really sure. I don't want to speak because I don't know her thoughts, but there is some worthwhile debate around that. But she definitely didn't want people in poverty having more children. She saw them as problematic for society. She was an elitist and a eugenicist. So anyone that would be considered a drain on society needed to not reproduce. Um, so moving forward, she presented, and this is really important because this is how language and propaganda works. She promoted it as freedom for women and women's rights. And so as we move forward, we see in 1973, the Roe v. Wade case occurred where a woman in Texas went to an attorney regarding wanting to have an abortion and ended up changing her mind, did not have an abortion, but the attorney ran with that case and made it a case around she was raped, she was not, and that she should have a right to an abortion. And so she was exploited by this attorney to push the abortion agenda. And we saw further yet again women's healthy biology being represented as the issue. We need to deconstruct a woman's healthy biology. We need to terminate her offspring so she can have freedom. And so those were the messages from the very beginning, from 1920 through 1970 until now. My own personal experience with Planned Parenthood, in the year 2000, I was homeless, addicted, and living in my car. And I was in a relationship with someone who I thought had cheated on me, and I had contracted an STD. At that time, I had had some spiritual abuse and some issues with my immediate family. So I turned to Planned Parenthood rather than the church or my family. As of now, that's all been reconciled. So I bear no ill will against anyone involved. But at the time, I turned to Planned Parenthood. And when I went there, they did confirm I had contracted an STD from this individual. And while I was weeping in their office about realizing this had happened, their language was, well, it would be such a shame to potentially have a child by someone who would treat you so badly. What an embarrassment. We're going to help prevent pregnancy for you. Meanwhile, I was very young, didn't know much about reproduction or biology. I had never been pregnant before, didn't realize when they did the blood work for STDs, they had done a blood work for pregnancy and knew I was actually pregnant. And what they gave me was RU-486. So I ended up having an abortion over the next 48 hours, and I had no idea what was happening to me.
Yeah. RU-486, define that for people that aren't familiar with that.
Sure. It's a process of two different medications, mifepristone and misoprostol. And so one of them stops the production of progesterone, which is what supports pregnancy. It's what able to keep both the placenta and the child growing and connected to the uterus. So it stops the growth of progesterone. And then the other one creates contractions so that everything will be pushed out of the woman's body. So child, placenta, and all parts of contraception will be pushed out of her body. So basically she'll labor and give birth to a dead child. And
so if anybody's heard of, quote unquote, the abortion pill, that's what you are referencing.
Correct. And it's different now than it was in 2000 as far as like how many pills you're given and how it all, but it's generally the same process. Yes. So I was given no informed consent around that. And between all of us, I generally do believe that nurse practitioner thought she was helping me. I think she saw a woman homeless, addicted, in crisis, in an abusive relationship, and thought, there's no way she can be a parent. This is going to be harmful for her. I think she believed that propaganda that she needed to save me or rescue me from my own body. And I don't think she intended harm, but I had no informed consent. So when I started vomiting profusely and hemorrhaging profusely, I had no idea what was happening to my body. But at that point, I had no safety net, no security. And so I just laid on the floor of a bathroom praying I wouldn't die. And
then, again, there's such parallels with what's going on with kids that are being whisked off to Planned Parenthood to be given this all this medication now. Right? Keep going. So the issue of informed consent, the issue of mandatory reporting. Keep going.
Correct. So I want people's patience. I will get there. All the dots are connected. I will get there. So I shoved that experience down for several years, and it took multiple years, but became a therapist and ended up in reproductive mental health. And since I've been specializing in reproductive mental health, the number of women, both I've personally talked to and on private abortion recovery groups and different boards that I've seen talk about the coercion and manipulation that happens within Planned Parenthood and the lack of informed consent. This is not a new phenomenon. This has been happening to thousands, if not millions of women for 30 plus years in Planned Parenthood clinics and other clinics as well. What women often tell me that have guilt, grief, regret is their number one issue is a lack of informed consent. They were told euphemisms like it's a clump of cells, or if they say, what will happen to my baby? We don't use the term baby here, it's a fetus. So language is being manipulated, and this is what we see with gender dysphoria in children in Planned Parenthood as well. This euphemistic language and controlling the understanding of what's happening around that. And when being told, of course you can't do this. Of course you can't possibly raise a child in your circumstances. Let us help you get out of this crisis. And they think that they're being helped, but they're given no informed consent. And then it used to take about 10 years on average before a woman would come to an office seeking help from an abortion experience. Now it's less than 24 hours that we have women, thousands, reaching out for help. So when Roe v. Wade fell in 2022, the summer of 2022 was repealed, Planned Parenthood saw the writing on the wall and pivoted to treating gender dysphoria. Well, their view of treatment is very similar to their view of treating women with crisis pregnancies. There is no actual counseling. They'll say they have abortion counselors. There's no licensed counseling professionals in their clinics. They aren't doing actual counseling. What they're doing is affirmation and sales pitches. They've been doing this to women. Now they're doing this to children. Of course you're trans. Of course you're in the wrong body. No actual mental health surveys even being done, no look into mental health complications being done for either demographic, women or children. And then they will do their intake, and that will be sent off. If in the states it requires a sign off of a therapist, it'll be sent to a therapist who's not even on site. Here's their intake, they sign off on it, and that child is just, here's your testosterone or here's your progesterone or estrogen that day.
So when people hear the term gender affirming care, you're
Mhm.
now describing gender affirming care.
Correct. hmm It's absolutely, you can self-diagnose, and we will just assume that is correct. We will ask no questions around it, because we are the kind people who challenging you or even making sure you understand concepts is not okay. That's a problem. So we're going to go ahead and just affirm you and not give you any information and just offer you what we think you want.
This is just fast tracking.
Correct. Correct. It's just salesmanship. It has nothing to do with therapy.
And we're talking, it's not even potential, we're talking lifelong implications, sterilization. And then if a kid gets on that moving
Mhm.
sidewalk, they're eventually going to continue eventually being dumped out onto a surgeon's gurney and be amputated, have all their sex organs amputated.
Correct. Research indicates that children who are not affirmed but instead given exploratory therapy, over 80% of them desist or return to congruence with their sex by age 18. Those affirmed more often end up in surgery. And now we're just starting to see the mass waves of detransitioners from that having happened for the last 10 years.
This is exactly what a cult does.
Correct.
It's exactly what white collar psychopaths do, by the way.
Yes.
The right impression management and the manipulation. You've got somebody that's vulnerable. You're going to override their intuition. You're going to appear compassionate. Meanwhile, you're objectifying this person. This is a
Correct.
means to an end, dollar signs. It's big business.
Well, and that's the whole basis behind queer theory or gender theory, is that your one demographic of your sexuality or your gender is your entire identity. And so if we don't affirm what you think your entire identity is, we're saying we don't think you exist. And this is where we see the claims of you want to eradicate trans people or you want to commit trans genocide. None of that is true, but they're reducing people down to one part of their entire personhood and saying that is your entire identity.
Which is ironic because when you think of it, what I've said is this. Psychology used to genuinely be about trying to help people's self-esteem, the self-esteem of young people. Well, that used to be in helping them, it's twofold, accept themselves as they are, and then figure out their competencies and what they're good at. So that's how you build self-esteem. But the trans deception comes along, trans movement, the pushers come along, and they say that the way forward, the way into better mental health, feeling better, is to eradicate yourself, meaning you're not okay as you are. We're going to do a sex change. You notice they never use that term anymore. And they go so far as to saying they're born in the wrong body. You know, they tell these kids born in the wrong body. And they eventually have a term. It's very telling. And think about sexual abuse victims who end up it's going to create trauma, and a lot of trauma survivors dissociate. So they don't feel connected with either bodies or their core parts. The parts become shattered. IFS, internal family systems therapy, does a wonderful job with that. So they're telling these kids now, along with the pronouns, that they have a dead name, and we're no longer to use the dead name. I want parents to, as a matter of fact, Robin, tell parents what a dead name means.
Yes. So dead naming is when you're no longer allowed to refer to that individual as their given name by their parents at birth. And if you do use that, you are erasing their identity because that person is dead. And this new identity.
Think about the doublespeak. Think about the doublespeak.
Exactly.
And for sexual abuse survivors, this is what's so traumatic. This is what's so egregious. Because if you have a young person who was molested, who was abused for a long period of time, they can end up dissociating and have, as it were, multiple parts. And the core part of them holds the pain. And so like any of us, we want to sort of push that away. And if we don't acknowledge it, if it doesn't exist, then we don't experience it. So they already have a propensity, and part of therapy, trauma therapy, is to help them come to understand and then embrace that part of them that they have tried to eradicate, that they don't want to hear from, that core part. So what we're doing is we really are consigning them to a perpetual internal split where they will never experience a lack of all the mental health issues because truth is trying to surface.
Correct. And it's creating a constant victimhood and an inability to withstand discomfort. And a lot of part of trauma care is processing discomfort and learning to build up that muscle that discomfort doesn't require running away or disassociating or splitting. We can withstand discomfort and move forward to healing. They don't want to ever talk about forgiveness. For me, getting over my molestation and rape experiences, forgiveness was the key to my healing from that and stopping dissociation that was happening around that. It was recognizing that what happened to me is not who I am, but I'm tied to something much, much larger than my physical sex parts or how they were used. But they want to reduce everyone down to their physical sex parts and how they use them, which if you're a trauma survivor, that's the scariest possible thing. I need to get away from those.
And hence, if you push a part of you away and you even use the term dead name, I mean, that's a perpetrator's ideal scenario. Right? Talk about Silence of the Lambs and speak to that, how Planned Parenthood is in a way a predator's best friend.
Well, of course they are, both from children who are looking for a judicial bypass for abortion, or children who are experiencing what they believe to be gender dysphoria. Planned Parenthood separates them from their parents. Of course, your parents don't understand you and don't get you, and we do, and we affirm who you think you are now. And yes, you're absolutely right. You are a victim and you're traumatized, and the only path forward is to kill that part of you and try to move forward in this new identity. And yes, you need to distance yourself from your family, and we can help you do that. And you think of, is it Jeremy Marsh? Is that, or Jeffrey Marsh? I can never remember his first name.
Jeffrey Marsh. Oh,
Jeffrey
gosh.
Marsh, who's got all these videos on how to go no contact with your parents. I mean, it's a predator's dream to have
he's a
these
very
children.
dangerous. He's a very dangerous
Extremely
individual.
dangerous individual.
He's on
Yes.
TikTok and Twitter and all that stuff.
Yes. And I will tell parents, I have teen children, and I have 4 children, 6 to 15. They are not allowed ever TikTok until they're 17, 18, and we can talk about the dangers on that. But they're not allowed Snapchat or TikTok at all, period. And I would encourage all parents to hold those boundaries. I do think we need to teach kids appropriately how to use social media, but we can do that with other platforms. Those two, in my opinion, are the most dangerous platforms available for children. But going back to Planned Parenthood and my experience and children at risk. So my oldest child is 15 and identifies as bi, but if you ask her, she will tell you, I don't have a sexuality, I'm not sexual. I'm just attracted to both boys and girls. And she's very confused why adults think attraction is sexuality. She doesn't understand that. Even at 15, she's like, I don't understand why people think I have a sexuality. I have attraction. And I think attraction to both genders is normal. There's beautiful women, there's beautiful men. So we are very affirming of, like, you're allowed your attractions. She has a girlfriend, that's fine. We just keep safety measures around her. We don't allow her to be alone with whoever she's dating or attracted to, because she's not old enough to be making sexual decisions at her age. And so we don't want to put in any position where she might have to make those decisions. And so we just keep safety nets around her. But she was seeing a therapist who we thought was a wonderful therapist for a very long time. And then recently, a group of therapists in my area decided that I am transphobic and racist and wanted to cancel me. And it became known to us that her therapist agreed with them that I am professionally unethical and they can't.
By cancel, meaning they went after your employment.
Yes. I mean, they outwardly stated, we can no longer refer to you. We think you are unethical, we're making reports to the board. We think you're unethical and your license should be removed. And so her therapist was agreeing with that. And so her therapist, I'm sure, assumed, I don't know what she assumed, but she was shocked when she was no longer her therapist. She couldn't possibly understand why she wouldn't be my daughter's therapist anymore. What she doesn't know is we are parents raising critical thinkers. but we're also protectors. So I went to my daughter, who's 15, and said, hey, I've learned that your therapist believes in gender theory and queer theory, and my daughter is already aware of what those are. And I want to know what you think of that. You have 48 hours to kind of think about it and let me know. And my daughter came back to me and said, I don't feel safe there because I don't want to be exploited for my sexuality by a therapist who thinks that's what my identity is.
Okay, that is so crucial right there, Robin, because they will, the other side, the pushers of this, will say that those that have concerns, at the very least, are pushing their values on clients when the reality is what?
No, the reality is those who believe in those ideologies are pushing their ideologies on clients.
That's activism. A therapist
Correct.
is not supposed to be an activist.
Correct. And their own personal time, absolutely. Do your thing, but not in the counseling office.
We're always up against the clock. And that's a perfect place to end for this episode. Robin, we're going to have you back if you'd be willing to. You're just a wealth of knowledge. What a subject matter expert. We've just touched briefly on, there's so much more to talk about Planned Parenthood, because now Planned Parenthood used to be pro-women, but now it is facilitating very sexually deviant men. You know, so they're not marching over the protection of women in private, having these deviant men in private spaces. So it's turning girls into boys, boys into girls, and women into men, and men into what you can't. But you have very dark and deviant men that are going into private spaces, you know, spas and sports to get into the access to the shower rooms, and then deviant men in women's prisons, and not a word out of Planned Parenthood and those that blame themselves.
I want to remind people, Planned Parenthood started by claiming women's biology was the issue. They were never pro-woman.
There we go. Well, we just touched on, and there's still so much more to talk about Planned Parenthood and those that are really exploiting women. We talked about your experience with an activist therapist. We're going to talk more about that and so much more about on future episodes, and how these kids are being exploited and manipulated. And the issue of mandated reporting, I think we need to come back to that. Also, the issue of informed consent. We dealt with that in part one, but boy, these need to be reviewed again. Robin, thank you so much.
Thank you so much for having me. It's been a pleasure.
And before we go, how can people get a hold of you?
Okay, they can look at my website, www.charisatveritasllc.com, and I'll spell that. It's CHARISETVERITASLLC.com. If they want to find me on Twitter, Twitter is not a professional space for me. That's just Robin doing Robin's thing. And that's at Truth Agape on Twitter. They can find me there.
That's how you and I found one another.
Exactly.
So, I look forward to future interactions. And Brad, thank you so much as always.